Arteriosclerosis. Arteriosclerosis is a heart disorder, and the factors that lead to this disorder are unhealthy diet, smoking, high blood pressure, and high blood cholesterol levels. The condition where blood has high cholesterol level is known as hypercholesterolemia. If we look at the heart closely, we observe a coronary artery which supplies blood to the heart. Inside this artery, we observe various blood cells like the RBCs, WBCs, and platelets. We also witness a very high concentration of cholesterol. This high level of blood cholesterol gets absorbed into the endothelial layer of the artery and forms a swelling, thereby reducing the diameter of the lumen of the artery at that point. This stage of the disorder is known as atherosclerosis, where the smooth flow of blood is hindered due to the clogging of the artery. Due to this cholesterol deposition, a new protein starts to stick onto the endothelial surface of the affected area. This protein attracts calcium ions flowing in the blood and binds with them. Calcium ions form a hard crust over the swollen area containing the plaque. This causes the artery to lose its flexibility and become stiff. This condition is termed as arteriosclerosis. Let us now study how to treat arteriosclerosis. The procedure is known as angioplasty, which is the technique of mechanically widening the narrowed arteries. A thin tube is inserted through the blood vessel in the groin area. This is then guided to the heart. Through the aorta. This thin wire is then sent into the area of blockage. The wire has a tiny balloon attached to it. The balloon is inflated and deflated alternately. This causes the calcium layer to break up and the cholesterol layer below the epithelium to compress and flatten the plaque. As the blockage is eliminated, the width in the lumen of the artery is restored. After this, a stent is attached to the balloon. Unlike the balloon, once the stent is expanded, it remains in place, serving as permanent scaffolding for the widened artery. The advanced stents have a coating of drugs on their surface. They are called drug-eluting stents, and they dispense medication into the artery to prevent the settling of the cholesterol molecules, thus eliminating the risk of reclogging of the artery. Thus, the blocked artery is now restored to its normal functioning. To summarize, atherosclerosis and arteriosclerosis are disorders of the large and medium arteries like the coronary artery. In atherosclerosis, due to the buildup of cholesterol in the blood vessel, a plaque is formed. This is the stage of atherosclerosis. But if this condition persists for a long time, the plaque begins to harden. This is due to the proteins being deposited and then the calcium layer getting formed. This causes the artery to lose its flexibility. This condition where the artery is not flexible is termed as arteriosclerosis. These disorders are corrected by angioplasty, where a stent is used as a scaffold to maintain the lumen diameter, thus ensuring the proper flow of blood.